Dr. Hall here, continuing on with our lecture on hormonal contraception, focusing now on the benefits and risks of combined hormonal contraceptives. So there are actually lots of benefits of combined hormonal contraceptives, and so that is part of why they are used so widely, not just for birth control, but also for treating lots of problems. So they're really useful for treating menstrual disorders like dysmenorrhea, which remember is painful periods, menorrhagia, which is really heavy periods, or irregular periods. So when you're on CHCs, you have regular, lighter, less crampy periods in general. That's not true for everybody all the time, but for most people, most of the time it is. So these can be really useful for treating those. There's also a progestin component. So remember with the disorders of ovulation where you have irregular periods, that can increase your risk for endometrial cancer down the road. This is also going to be protective against that. As we mentioned, because of the increase in sex hormone binding globulin, which then binds more testosterone, CHCs can also be useful for treating acne. And so, of course, they're very useful for treating PCOS for the same reason, as well as because they're also treating the irregular menses associated with PCOS. CHCs can also, due to their negative feedback and suppression of follicular development and ovulation, be helpful in the treatment of ovarian cysts, so they are often used for that reason. They can additionally treat endometriosis because the endometrial thickening, or the thickening of any endometrial tissue that occurs on CHCs is much less than with the typical menstrual cycle. And as we'll talk about in a minute, we can also use CHCs to skip periods altogether, which can also be really helpful if you're treating dysmenorrhea or menorrhagia. You can just skip the periods altogether. And for the same reason can be useful for treating PMS and PMDD, right, which are those mood symptoms, as well as some physical symptoms that can be due to the hormonal fluctuations that happen in the week before and the first several days of the typical menstrual period. So I just mentioned that you can skip periods. So we call that either extended or continuous cycling. Seasonal happens to be a brand name of a birth control pill that was designed to be taken that way. So you can see in the pack that there's 1, 2, 3 months worth of continuous pills, and then you don't take any placebo pills until that final week of the 3rd pack. Hence the name seasonal, because that is when you then have your withdrawal bleed. So you basically have a period once a season, spring, summer, fall, and winter. So that's how that one got that name. So oftentimes the first thing people say to me is, well, isn't that unhealthy to not have a period? Isn't that bad for you to not have a period? The answer is no, if we're the ones that are doing it to you with CHCs. If on your own, however, not on any birth control, if you're not having regular periods, then that tells us that there's something off with your menstrual cycle, you're not ovulating regularly, therefore we're thinking about hypothalamic amenorrhea or polycystic ovarian syndrome, right? So not having a regular period can be a sign of an underlying problem. So that's if you're not on pills, though. If we're using pills or other types of CHCs to have you skip periods and not have periods, that's totally fine, right? Because we're not causing an underlying problem. We're just changing how your uterus works. There is no need, we've talked about this before, there is no need for the uterus to, quote, clean itself out once per month. The uterus is normally a sterile environment. That cervical mucus keeps bacteria out. You'll recall the vagina is full of bacteria normally. So there's no need to have a regular period when you're on birth control. If you're not on birth control and you're not having regular periods, that means you're not ovulating for some reason. That means there's some type of underlying problem that we need to address. But if you're not having periods because you're taking birth control in a way that has you not have periods, that's totally fine. So this is all of that information in text. And I do want to point out one thing. So you can do this with CHCs, you can do this with pills, and you can do it with the ring. But we do not recommend extended or continuous cycling with the patch because its dose is higher. Now, certainly if you're going to do this with pills, you can get pills like Seasonal that are marketed this way, or you can just use regular pills and simply not take the placebos and instead start a brand new pack. And so you just take several more weeks of active pills before you then eventually take a placebo. Now, some people's uteruses feel like they cannot be denied, and if you try to go too many weeks without having a withdrawal bleed and taking placebos, they'll start to get irregular bleeding. So some people can't go for a whole year without a period, without their uterus kind of acting up a little bit, but it's different for everybody. You can do this with the ring as well. What you do is you put in a ring at the first of the month, leave it in all month. Then you take it out and you put a new one in at the beginning of the next month. Pretty simple and straightforward. So some other benefits of CHCs, aside from the ones I talked about and the ability to do extended or continuous cycling and have fewer periods in general, is that they decrease your risk of getting endometriosis. So not only are they helpful in treating endometriosis, but they also decrease the likelihood that you will develop it. And they decrease your risk by both ovarian and endometrial cancer by about 50%. A person who uses CHCs for 5 years or longer has half the risk of ovarian and uterine cancers as someone who has not. So this is a huge health benefit, and they talk about it a little bit in that article, John Rock's Error. And so partly because of that and partly because of the decreased risk of pregnancy, CHC users have an overall decreased risk of death compared to people who are not using hormonal birth control. So there are many, many benefits to CHCs aside from simply, I don't want to get pregnant. So we use them for lots of reasons. Of course, there are also potential side effects and risks. So let's talk about the cons side of the equation. So there are some side effects that can be really common when first starting a CHC method, pills, patch, or ring, and they tend to be common in the first few weeks to months and then gradually resolve. So things like nausea, very common in the first several days, some breast tenderness, and in some cases, some people get breast enlargement. Some people like that, some people don't. I once had a marathon runner who hated it, right? So we ended up having to take her off of her CHC. Headaches, mood changes, and definitely some irregular bleeding or spotting in the beginning as the body is kind of adjusting to being on the birth control. These are common, they're usually mild, and they usually resolve in the first weeks to months and get better on their own. So we recommend that unless they're severe, they keep taking the birth control, right? Don't stop, keep taking, and then these will go away in time. Now, occasionally these are severe or they don't go away. And if that happens, then we need to try something else. There are a few less common side effects that I also want to talk about. So one is changes in libido or sexual function. This is interesting because most studies looking at sexual function in people who start CHCs show improvement. And we think part of that is due to loss of the fear of pregnancy. So people are less afraid and more able to enjoy sexual activity. But there are some people who report that they have a decrease in libido or a decrease in their ability to orgasm when they're on CHCs. This is very uncommon, but it is reported by some people, in which case then we'll want to switch them to something else. Persistent or significant mood symptoms. So when we talked about PMS and PMDD, we talked about how there are receptors for estrogen and progesterone in the brain. And some people are very sensitive to these hormones and can have significant mood side effects. So that can be a very real phenomenon. It's not common, but it can happen in some people. Persistent or significant headaches or worsening of headaches can also sometimes happen. So that's something that we need to watch for and then potentially change method if it develops. Changes in vaginal lubrication, we mentioned that particularly with the ring, and sometimes it can be so severe that people develop a whitish discharge, which is called leukorrhea, which can be bothersome. It's not common, but it can happen. A mild elevation in blood pressure can happen rarely, as can an increased risk for gallbladder problems like gallstones due to the estrogen component in CHCs, as well as sometimes some pigment changes in the skin, like some dark patches on the skin, often of the face, in the cheeks, or above the upper lip. Not common, but can sometimes occur. So all of these side effects that I've talked about so far are things that are, for the most part, annoying, but not dangerous, although sometimes mood symptoms can be dangerous. But now we're going to transition into things that can be potentially quite dangerous. So one of the things about estrogen, and we talked about this when we talked about pregnancy and risks of pregnancy and childbirth, is that estrogen increases the tendency of blood to clot. So we talked about this with pregnancy. Sometimes blood sitting in a vein can form a clot, right? And if that clot, and that's called a DVT, right? A deep vein thrombosis, and that can cause pain and swelling in the area where the clot has formed, which is usually in the leg. So it's usually pain and swelling in the calf. Sometimes a piece of that clot can break off. That's called an embolus. It can travel through the bloodstream and end up lodging out in the lungs, and that's called a pulmonary embolus. Remember, that can cause chest pain and shortness of breath. Serena Williams had that after her daughter was born. These can be fatal. So birth control can kill you, right? Because you can get a DVT that can turn into a PE. We probably diagnose 1 or 2 of those per year at the Student Health Center on our campus of about 8,000 students, right? About 4,000 of whom are potentially eligible for birth control, right? So, however, the risk of actually having one that is severe enough to kill you is about 1 in 50,000. In fact, the overall cause of death as a result of CHCs of any cause from the birth control is 1 in 50,000. So let's just put that in perspective. The risk of death from pregnancy and childbirth in the United States is 1 in 5,000. And based on your age, if you're in your early 20s, your risk of dying in a car accident is 1 in 2,000. So yes, birth control can occasionally be fatal. It's very uncommon. But of course, it's something that we take very seriously. So if someone is on CHCs, they develop leg pain or swelling or chest pain or shortness of breath, we get them evaluated right away. This is a problem that we can treat easily and effectively the vast majority of the time with blood thinners. So if it does develop, it's something that we can treat and prevent people from dying from. But this is the big scary one. This is just some further information about blood clots and CHCs, a lot of the things that I just talked about. Certainly, if you have a family history of blood clots, or if you have certain autoimmune diseases that increase your risk for blood clots, that might make us choose to not risk using CHCs in that person, depending on the details of that. There's also a risk of stroke with CHCs, again because of the estrogen component, because of the likelihood of forming blood clots. So a blood clot in a blood vessel to the brain is one of the causes of strokes. So there is a very, very, very small risk of stroke in anybody who uses CHC. What's interesting is that people who have migraine headaches also have an increased risk of stroke, aside from whether they're using birth control or not, and especially if they have migraine with aura. So this animation where we see kind of these flashing lights or fuzzy thing, this is what's called an aura. It's a visual symptom that develops before the headache in people who have migraine. So migraine with aura is a very specific subset of people who have migraine. I'm gonna make that go away because it makes me ugh. Right? So anybody who has migraine headaches are themselves at increased risk of stroke. That risk is higher if you have migraine with aura, where you kind of see those spots or flashing lights. And because the estrogen component in CHC increases your risk for clots, women who have migraine with aura, because their baseline risk of stroke is higher, should not use any estrogen-containing birth control. It is medically contraindicated. The absolute risk of stroke from a woman who has migraine with aura taking a CHC is about 1 in 10,000. So it's very rare, relatively speaking, but it's potentially devastating, right? You only have one brain, right? And you're a young, healthy person. You don't want to be having a stroke if you can avoid it. So this is another potential risk that we take very seriously, and is why if someone has a history of migraine with aura, we are not going to prescribe a CHC for them. What if somebody has high blood pressure? So high blood pressure is also called hypertension, and people who have hypertension are inherently at higher risk of strokes and heart attacks because of the stress it places on their blood vessels. So for those folks who have hypertension, estrogen-containing CHCs are also contraindicated. The absolute risk is still very low. It's less than 1 in 10,000 by far, but these are young, healthy people. So we don't want to take any chances, right? We have millions of young, healthy people taking CHCs, so we want to make sure that we don't increase the risk for a potentially devastating event when we have other alternatives for ways to prevent pregnancy. So this is a chart that shows you just some of the medical conditions that we have to take into account when prescribing birth control. You don't have to, study this at all. I just want to show you something graphically. So this column right here and right here, that first column, those are the CHC methods. And so anytime you see a pink or a red, that's either a strongly not recommended or a medically contraindicated, meaning you should not use these methods. So there are lots of different medical conditions that we take into account when deciding what type of birth control is safe for someone to use. So I've just shared with you a few, right? The issue of blood clots, migraine with aura, and high blood pressure. So those are the only ones I'm going to want you to be aware of. But just know that there's a lot that goes into making sure that when we prescribe birth control for someone, we're doing it safely. We've talked about this one before. So a couple of years ago, a study came out that showed that birth control pills or CHC methods in general, or any type of hormonal contraception actually, raises your risk of breast cancer. So I just want to remind you what we talked about from that study. The absolute risk, because they only found an increase in breast cancer in people under age 50, which is rare to begin with. So you went from 5 to 6 people out of 7,690. So your absolute increase in risk was 0.013%. So it was a very, very tiny increased risk that they saw. And you might recall that there were some flaws in this study. For example, they did not control for age at first full-term pregnancy, which we know is a risk factor for breast cancer. Also, to put it in perspective, this is a much, much smaller increase in risk than that seen with alcohol use, right? So heavy users of alcohol have a 15% increased risk of breast cancer, right? That's way more than 0.013%. So a few take-home points about that, right? So there was a very, very small but measurable increased risk of breast cancer found in this study. However, because pregnancy itself is dangerous, in all studies that look at all causes of death, people who use birth control are less likely to die. So it's not just because they're not getting pregnant, which is part of it, but they also have a significantly decreased risk of endometrial cancer and ovarian cancer by about half, right, on each of those. So a teeny tiny potential maybe increased risk in breast cancer from a flawed study versus known demonstrated substantial decreases in endometrial and ovarian cancers. So today we talked about benefits and risks of CHCs. So benefits, not getting pregnant, right? So even for typical users, CHCs are 92% effective in preventing pregnancy. And in perfect users, we're talking, more than 98% effective. Really good for treating lots of menstrual disorders as well as acne, and they decrease your risks of both uterine and ovarian cancers. There are some common and usually mild and temporary side effects when first starting, including nausea, headache, mood changes, and breast tenderness. But there are also some potential serious risks that we need to keep in mind. Basically, blood clots, ones in the legs that can travel to the lung and cause a pulmonary embolus, ones that can travel into the blood vessels in the brain and cause a stroke, which is a contraindication then to use of CHCs in people who have migraine with aura because of their baseline higher risk of stroke, and also people with high blood pressure because they have a baseline increased risk of heart attack and stroke. They should not use estrogen-containing birth control or CHCs either. So the next thing we're going to be talking about is options for people in whom we don't want to use estrogen. So next we're going to talk about the progestin-only forms of birth control.